my name is Kayla. I'll be your student nurse today. How are you doing today? Good. Can you tell me your name? Okay. Can you tell me where we're at? Do you know the date today? Okay. And can you tell me why you're in the hospital today? Okay. So our patient answered the level of consciousness questions appropriately. According to the Glasgow Coma Scale, he is awake and alert and oriented. His eyes open spontaneously. He is oriented and he obeys motor commands. Can you squeeze my finger? And he squeezed my finger. Next, I'm going to assess his remote in recent memory. So, Mr. Chimp, do you remember what you had for breakfast today? Oh, you had some oatmeal and some blueberries? Okay. And what did you have? When was your last surgery or hospitalization? Okay. And both of these questions should be answered in the patient's chart or in dietary records. So that's why I asked those questions. The patient seems to be calm and compliant today. So the patient's affect is calm. Speech patterns, Mr. Chimp seems to be communicating appropriately at the appropriate speed for his culture. Now, Mr. Chimp, I'm going to assess your facial expressions. This is going to be testing cranial nerve 7. So can you look up for me and give me a smile? And can you give me a frown? Okay. Can you puff your cheeks? And can you wrinkle your forehead? Can you raise your eyebrows? Okay. Thank you, Mr. Chimp. Cranial nerve 7 is intact. Next, we're going to test your pupillary reaction to light. So this is called the parula. So I'm going to take my light, my pen light, and I'm going to shine it on this side. And I'm going to move over here and shine it on that eye. Okay, I'm going to do it one more time just to make sure I saw what I saw. Okay, so on both eyes, the pupillary reaction, we call it the direct response. So when I shine the light on that eye, the pupil constricts. And then the consensual response, when I'm shining on the eye, the other eye is also going to constrict. So Mr. Chimp's eyes are round and reactive. Can you focus your eyes on the wall behind me? Okay. And then bring your focus onto my finger. Okay. And bring it back on the wall. And back on my finger. And now follow my finger. I'm going to go close towards your nose, okay? All right. So when Mr. Chimp was looking far away in the distance, his pupils were much bigger. And when he fixed his sight on my finger, his pupils constricted. And then when I had him focus on my finger and I brought it towards his nose, his eyes like converged, I guess you could say. They like crossed to like get a better view of my finger, and they constricted as well. So cranial nerve 8 is intact. His pupils were equal, round, and reactive to light, and they accommodated. Now we're going to assess extraocular movements. Okay, Mr. Chimp, follow my finger and only my finger with your eyes. Okay, and we're going to test the 6 cardinal fields of gaze. Okay, and we're going to do this again on this side. All right, and there were no beats in nystagmus. Out in the extremes, nystagmus can be seen, and that's considered normal, but Mr. Chimp had no beats in nystagmus. So cranial nerves 3, 4, and 6 are intact. Now I'm gonna verbalize how to assess near, far, and peripheral vision. So if I were assessing Mr. Chimp's peripheral vision, I would do the confrontation test, and we both would cover an eye, and we would both identify when we can see the finger come into our field of vision. And then to assess near vision, we would use the Rosenbaum chart. We would hold the chart 14 inches away from Mr. Chimp's face, and he would read the lowest line that he can. And when he reads that lowest line that he can, that is his visual acuity. And then when we're assessing distance vision, we will use the Snellen chart. In the Snellen chart, Mr. Chimp would stand 20 feet away, and again, he would read the lowest line that he can, and that would be his visual acuity. And if he can successfully do that, cranial nerve 2 would be considered intact. Okay? We're going to assess your hearing acuity by doing the whisper test. So I'm going to turn you around, Mr. Chimp. In real life, I would be the one moving, but we're kind of stuck on the desk right now, okay? All right, Mr. Chimp. So the patient will occlude his opposite ear from the one that I am standing on. So he would occlude this ear, and I'm going to cover my mouth, and I'm going to say two-syllable words. Hot dog. And the patient would repeat hot dog. And I'm going to say pencil. And the patient would repeat pencil. And we would repeat that process on the other ear. So candle. And the patient would repeat candle. Coaster. And the patient would repeat coaster. Okay, Mr. Chimp, your cranial nerve 8 is intact. You heard the words that I said. Good job. Now we're gonna assess your balance and equilibrium through the Romberg test. So if you could stand up for me, Mr. Chimp. Yeah, that's about as good as you're gonna get. Okay. Mr. Chimp would stand up, but his legs are kind of stuck in a sitting position. So Mr. Chimp, I'm just gonna verbalize how to do it. Mr. Chimp would be standing upright. His feet would be together, and he would fix his vision on something far away, like a wall, for 20 seconds. And we should see minimal to no swaying. And once we do that 20 seconds, we can have Mr. Chimp close his eyes, and we can repeat that test. So again, he'll have his feet together, hands by his side, and we're going to see minimal to no swaying. And if we see minimal to no swaying, we know that cranial nerve 8 is intact. Now I'm going to assess the ears for size, color, droopage, and tenderness. Mr. Chimp, are your ears bothering you? Are they tender today? Patient denies tenderness. Size is appropriate. Color is appropriate. And there is no drainage on that ear. And patient denies tenderness. There's no drainage. Color and size is appropriate. I'm going to test the patency of his nostrils. So, Mr. Chimp, I'm going to ask you to occlude one nostril at a time, and then we're going to take a big, deep breath in. Okay, I'm occluding one nostril. Take a big, deep breath. And we're going to repeat that process. Okay. And did one side feel like it was easier to breathe on? You said your left side was? Okay, good to know. His septum seems to be deviated a little bit to the right. So that would make some sense. And I didn't see any nasal drainage when we were assessing patency. Now, how I would assess your sense of smell, so that is assessing cranial nerve 1. And to assess cranial nerve 1, I would have the patient occlude one nostril, close their eyes, and I would have them identify the scent that is being placed under their nostril. And again, I would repeat that process with the other side. And if Mr. Chimp were able to identify those smells, cranial nerve 1 would be considered intact. Next, I'm going to assess your buccal cavity. So Mr. Chimp's mouth doesn't open, so we're going to pretend. So Mr. Chimp, can you open your mouth big and wide for me? Show me your pearly teeth. Okay, Mr. Chimp has 28 teeth, which is considered normal for an adult who has had their wisdom teeth removed. And can I see your tongue? You want to stick it out for me? All right, good. I don't see any white spots or patterns of discoloration. Surface papillae are present. Okay. And can you say ah for me? I'm looking at my pen light. and his soft palate and his uvula rise together. It does not deviate to one side. And now I'm going to look at your tonsils, okay? And your tonsils appear to be a 1+. They're not touching, they're very small. How I would assess Mr. Chimp's gag reflex, I would take a tongue depressor and I would touch the back of his pharynx on both sides, and I would do that test before I give any fluids or food, because you want a gag reflex there before you try and give anybody anything. So we're testing both sides, and if Mr. Chimp had a gag reflex present and was able to swallow, we would say the cranial nerves 9 and 10 are intact. And now, Mr. Chimp, I'm going to ask you to stick your tongue out and make lots of funny faces for me. Can you stick your tongue out like this? And can you move it side to side? Like that? And can you move it up and down? Okay. And can you push your tongue up against your cheek right here? Okay. And push. Okay. And can you do that again for me on this side? And push. Good job. So, cranial nerve 12 is intact. Mr. Chimp, can you clamp your jaw for me? And relax. And clamp it. Okay. And can you clamp it for me? And relax. Good job. So cranial nerve 10 is intact. His muscle contractions down here on the masseter and at the temples were equal bilaterally. Next, verbalize muscle strength, tone, and size. So Mr. Chimp's arms are equal bilaterally. Tone, you just kind of visually look at it. Strength, I would do isolated strength testing. So like push against my feet with resistance. Like that would be how I would grade his strength. And normal, good, strong strength is 5 out of 5 on this scale. Next, I'm going to assess Mr. Chimp's motor function here. Can you raise your shoulders for me? Do not let me push them down. I'm going to push down. Okay, good job. You can relax now. Cranial nerve 11 is intact. His shoulders rose bilaterally equally, and when I pressed on them, they didn't budge much. So the strength is intact there. Now I'm going to assess your joints for any swelling, tenderness, redness. Are any of your joints painful today? No? Okay. All right. I don't see any swelling or redness on that limb. Any swelling or redness on that limb. Any swelling or redness on that limb. Or any swelling or redness on that limb. Okay. And assessing your gait, Mr. Chimp, I would do this as you're walking back to the exam room if that's possible, because clients tend to modify their gait if they know you're watching. But Mr. Chimp, can you walk across the room for me? If Mr. Chimp could, he would. But we're going to pretend like Mr. Chimp's gait is normal. And now I'm going to assess range of motion unilaterally. I'm going to assess the patient's elbow. All right, can you extend your elbow, make it as straight as possible? Okay, good job. And can you bring it in like you're curling a weight as far as you can? Good job. Okay, so range of motion of the elbow is intact. And now I'm going to do the same for the foot. Can you bring your foot in like this? As far as you can. Good job. And can you bring your foot out like this? Good job. Can you raise your toes? Point your toes like this. Raise them up to the sky. Okay. And can you point them down like a ballerina? All right. Good job, Mr. Chimp. I am all done bugging you today. Thank you so much for being a good patient today. Bye, Mr. Chimp. And that's how I would assess his cranial nerves and musculoskeletal system. Thanks.